Hello everyone, welcome to sqadia.com, and in the third section of our lecture topic, Benign Lesions of the Cervix, we will talk about the cervical stenosis. In this section, we will talk about what is cervical stenosis, what are the different causes of cervical stenosis, and what's the treatment of cervical stenosis. So cervical stenosis is the narrowing of the endocervical canal. So this is the cervix, this is the internal os of the cervix. This internal os is the lower portion of the uterus. So, and the external os of the cervix, it opens into the vagina. This is the canal of the cervix, endocervical canal, and when this is narrowed, it's called the stenosis of the cervical or endocervical canal. This is the ectocervix or the outer portion of the cervix. So, pathological narrowing of the endocervical canal is known as cervical stenosis. What are the causes of stenosis? It can be surgical causes after the surgery is performed, usually due to adhesion, scarring. It can cause the stenosis of the cervix. Or it can be due to treatment of pre-malignant disease of the cervix when the biopsy is done or when loop diathermy is performed. Usually it can cause the narrowing or stenosis of the cervix. So it can be surgical or it can occur as a result of treatment of the malignancy, or when the biopsy is performed, or when there is loop diathermy, it can lead to cervical stenosis. Next, treatment of the cervical stenosis. As the name shows, stenosis is the narrowing of the cervix. So treatment basically depends on the dilation of the stenosis, and that is done by the dilation and curettage. And dilators are used to dilate the cervical opening. So surgical dilation under ultrasound or hysteroscopic guidance. So guidance is required to perform the dilation of the cervix, and that guidance can be done by ultrasound or by the use of hysteroscope that can directly, you can visualize the stenosis and it can be dilated. This is the uterus, rectum, and then we have bladder, vagina, and refractor. Refractor is actually help to visualize or give the refraction, and then the dilator is inserted inside to dilate the cervical opening. And sometimes after the dilation, the curette is inserted to remove the tissue or scarring. So dilation and curettage or curette is used, dilator and curette is used to dilate the cervix, and this is usually performed under the guidance of ultrasound or hysteroscope. So that was all about the cervical stenosis, and the cervical stenosis is, we said, it was the narrowing of the cervix, and it is usually treated by the help of the dilator, and most common causes of this is the surgical or the treatment of the pre-malignant condition. So thank you for watching sqadia.com.